Dear colleagues, with this video I would like to update you on the global priorities of the World Health Organization in the area of occupational and workplace health, and in particular our plans for 2025. Our first priority is framing global policy for comprehensive health action in work settings. The WHO Global Forum on Healthy, Safe and Resilient Workplaces, held a year ago in Geneva, articulated a new vision for workplaces. These are places where all people receive adequate health services to perform their jobs without getting sick or injured because of their work, while being protected in case of public health threats, with opportunities to enhance their physical and mental health and social well-being, and all this in harmony with nature. In technical language, this is a combination of occupational health and safety with workplace health promotion and preparedness of businesses for public health emergencies. Now we are working on a project to develop a policy on enhancing health, safety, and well-being at workplaces. And this will be a joint document with the ILO and a technical package of interventions and metrics to implement this policy at the national and workplace level. This work will require a lot of advocacy, communications, and capacity building. Next year, the Universal Exhibition Expo 25 will be in Osaka, and for the first time in the history of the World Exhibitions, it will feature special days devoted to safety, health, and well-being at work from 16th to 19th of July. On 17th of July, WHO will host a symposium titled Healthy Work for Happier Lives at the Expo Salon in Osaka. The theme focuses on the fact that work and workplaces shape much more than just productivity. They play a vital role in the physical, mental, and social well-being of everyone, future, current, and past workers and their families. At its core, good work improves lives by promoting happiness, quality of life, and overall societal well-being. It saves lives, empowers individuals, and ultimately connects people across industries and sectors. We encourage you to take part in the Expo 25 program and join the conversation about safety, health, and well-being at work and beyond. There will be other WHO activities at Expo 25, as I will show you later. Another priority in our work is occupational health and safety of health workers. A lot of work has been done already. We developed tools for capacity building, risk management, policies, and program development. All these tools are available in all WHO official languages. During the next year, we'll focus on the implementation in countries. We have an electronic tool on occupational hazards in the healthcare sector, summarizing the WHO and ILO recommendations for control of the different groups of hazards: infections, ergonomic, chemicals, radiation, psychosocial risk, violence and harassment, environmental hazards, and occupational injuries. Here is the suite of WHO tools for occupational health and safety of health workers. They are available in all WHO official languages. We encourage translation into other languages, dissemination, and practical implementation. This year, together with ILO and IOSH, we did a training for the member states of the Commonwealth of Nations on how to develop national occupational health and safety programs for health workers. This was short 3-hour online sessions covering introduction to occupational hazards in healthcare, elements of occupational health and safety programs for the healthcare sector, how to develop and how to implement such programs. The sessions also allowed for countries to exchange experience and ideas among themselves. We have commitment to the G20 network for occupational safety and health to do similar training for G20 countries and we'll try to do that in 2025. Beat the Heat is a new global initiative aligned with WHO's work on adaptation to climate change, specifically in workplaces. A lot of activities are already going on in regional and countries level, and with this initiative, we will stimulate the consolidation of all activities into concerted global action. The objectives of this project are to leverage the implementation of the international recommendations on occupational exposure to heat stress, ambient air pollution, and solar UV among outdoor workers, to strengthen the capacities of health systems to address the health impacts of extreme heat exposure and other health hazards in workplaces, to raise awareness about heat in work settings, about health and related health risks, and to advocate for the adoption of robust policies, standards, and regulations for prevention and monitoring of heat and related health hazards in high risk and other settings. This initiative will cover all workplaces, both indoor and outdoor, but also workers and the public engaged in the preparation, delivery, and legacy of megasport events and large mass gatherings. One key forthcoming event is the WHO Global Conference on Air Pollution at the end of March in Colombia, where there will be also attempt to address the protection of outdoor workers from ambient air pollution. And during the days for safety, health, and well-being in Expo 25 in Osaka that I already mentioned, together with partners, we're planning a Beat the Heat festival to raise awareness about health at work, to showcase different practical solutions, and to stimulate all people to adopt appropriate behavior to avoid heat-related illnesses. For further information, feel free to visit the WHO Occupational Health website or contact us by email at workershealth@who.int. Thank you very much. Have a nice day.